Hi, I'm Dr. Swanson, a Michigan veterinary specialist. I'm one of the oncologists here. And I think one of the hardest things for my clients is having their pets diagnosed with cancer. That I think a lot of times owners feel that that is something that euthanasia or putting them to sleep is one of their only options. Really, I think one of my jobs is telling you all the other options that are available. That things that are very similar to human medicine, like surgery or chemotherapy or radiation therapy, are all options for veterinary patients too. We tailor our treatments specifically to the veterinary patient so that everything is about quality of life and making sure that they're still feeling good, but that a lot of the same things that we can offer in human medicine are available to these veterinary patients too. If your pet is diagnosed with cancer, one of the things your veterinarian can do is oftentimes collect a biopsy. That lets us know the type of cancer that's present and allows me and the surgeons that are here at Michigan Veterinary Specialists the opportunity to best plan the surgical approach and see if we're going to be able to remove the entire tumor or if this is something that we might just be able to offer your pet more comfort by being able to remove a portion of the tumor or the most uncomfortable part of it. I think one of the treatments that is available for veterinary patients that we don't commonly think of is radiation therapy. That just like in the human field, we can use radiation therapy in a couple different ways. We can use it to make patients more comfortable, to temporarily shrink a tumor where we don't see any side effects associated with it. Certainly, like we see in human medicine, we can see side effects from radiation therapy, but I think the important part to keep in mind is that those side effects are temporary. This isn't something that we expect to continue long term, and my job as the doctor is to make sure that your pet is comfortable, that we're making sure that they're relieved of any discomfort that they're having during the treatments and then as they're healing from any of the side effects. And then after the fact, that they're returned to their same quality of life and running in the park, playing with their ball and enjoying life again. And I think one of the treatments that people most commonly think of when they think of treating cancer is chemotherapy. Chemotherapy can be a really scary word anytime that you've had a family member or a friend that's been treated with that. And I think anytime I mention that to some of my clients, we have to stop and take a step back. That we use chemotherapy in veterinary medicine, and we use some of the exact same drugs that they do in the human field, but we use a lot lower doses. That really everything about veterinary medicine, we need to be focusing on quality of life. And so when we're giving some of the same treatments, we'll see some of the side effects, but in general, I expect that most of my patients are eating and drinking and feeling good, that they're eating all the cookies that we're offering them, and they're still pulling me around the front lobby, that they're just enjoying life. That we can achieve some of the same control that we can of cancers in the human field, but that in veterinary medicine, they're feeling good.